Supine position.
Supine position, dorsal recumbent, is wherein the patient lies flat on the back with head and shoulders slightly elevated using a pillow, unless contraindicated, e.g. spinal anesthesia, spinal surgery. Lithotomy position. Lithotomy is a patient position in which the patient is on their back with hips and knees flexed and thighs apart. Semi-prone position.
The patient assumes a posture halfway between the lateral and the prone positions. The lower arm is positioned behind the client, and the upper arm is flexed at the shoulder and the elbow. The upper leg is more acutely flexed at both the hip and the knee than is the lower one. Fowler's position.
Fowler's position, also known as semi-sheaning position, is a bed position wherein the head of the bed is elevated 45 to 60 degrees. Variations of Fowler's position include low Fowler's 15 to 30 degrees, semi-Fowler's 30 to 45 degrees, and high Fowler's near vertical.
Lateral side lying position.
In lateral position, the patient lies on one side of their body with the top leg in front of the bottom leg and the hip and knee flexed, flexing the top hip and knee, and placing this leg in front of the body creates a wider, a triangular base of support and achieves greater stability. Prone position.
In prone position, the patient lies on the abdomen with head turned to one side, and the hips are not flexed.
Knee-chest position.
Knee-chest position can be in lateral or prone position. In lateral, the patient lies on their side, torso lies diagonally across the table, hips and knees are flexed. In prone, the patient kneels on the table and lower shoulders onto the table so chest and face rests on the table.
Trendelenburg's position.
Trendelenburg's position involves lowering the head of the bed and raising the bed of the patient. The patient's arms should be tucked at their sides.
Reverse Trendelenburg's position.
Reverse Trendelenburg's is a patient position wherein the head of the bed is elevated with the foot of the bed down. It is the opposite of Trendelenburg's position.
Kidney position.
In kidney position, the patient assumes a modified lateral position wherein the abdomen is placed over a lift in the operating table. Thal bends the body. Patient is turned on their contralateral side with their back placed on the edge of the table.
Orthopneic tripod position.
Orthopneic or tripod position places the patient in a sitting position or on the side of the bed with an overbed table in front to lean on and several pillows on the table to rest on.
Jackknife position.
Jackknife position, also known as Krask, is wherein the patient's abdomen lies flat on the bed. The bed is scissored so the hip is lifted and the legs and head are low.